Hello and welcome to Skills to Pay the Bills. Joining me today are two regular subject matter experts on this show. Shirley Liu, Executive Field Chairman for First Financial Security, Inc., and the handsome gentleman sitting next to her is Bobby Lee, Senior Marketing Director for First Financial Security, Inc. Shirley and Bobby are going to give us updates on the Affordable Health Care Act as well as on the open season for Medicare and Medicare Advantage products. We're going to have a great time today talking about the basics of these two very popular products. So welcome, Shirley and Bobby.
Well,
How are you guys doing today?
Thank you, Tia.
I'm tired.
Good.
I mean, already 6 different centers I've been at.
And you told me you hadn't had anything to eat yet.
I know, 6 different senior centers I've been at already.
Six senior centers already?
Yeah.
Wow. Bobby, what about you? Are you?
Oh, I'm getting very busy. You know, we do a lot of seminars and, radio shows, TV shows, just, educating people about all these programs. So it's been very, very busy.
Well, I'm going to reverse the order a little bit. We were going to start out talking about the Affordable Health Care, or Obamacare as some people call it. But I think we'll start with Medicare and Medicare Advantage products, because if I'm correct, I think open season is upon us. Can you guys tell us a little bit about open season, what it is, and how long do we have?
Well, you know what, open season starts from October 15th to December 7th. And what open season is will allow a Medicare recipient is to be able to pick a new plan, if they're not happy with their current plan. And every year with the Medicare, new plans come out all the time, and different carriers and different locations. So it's ideal for anybody that does have Medicare already to take a look at the new plans, and that's where we come in and be able to help them explain all the details.
So when you say they can select a new plan, does that mean if a person, let's say, has been on a basic supplement Medicare plan and they want to switch to Medicare Advantage, they can do that during this period?
Yes, during the open enrollment, they can do so within that time period.
Okay, and so wow, that's huge. Well, Shirley, what about you? What do you say about open season?
What makes it more special this year in open season is that they now have a very unique plan that's coming out called Zero Cost Premium Plan. And that's what's really getting a lot of traction.
Premium?
The Zero Cost Premium Plan.
Wow, we really want to hear more about that. We'll talk about that a little later.
It's one of those things that today people said, it's too good to be true.
Well, I've come across people who have said, well, if you got basic Medicare, why do you need anything else? Can you both address that? I mean, some people feel that if they got the basic A and B, and that's what I'm thinking means basic, right? Just A and B.
Well, you have to understand the way Medicare works is that when you're reaching the age of 65, 3 months before and 3 months after, you have to apply for Medicare. And Medicare automatically gives you Part A, but then you got to pay for Part B, about $104.95. So in order for, when you have A and B, basically it covers 80% of the costs associated with your health care. So that there's a gap of 20%, okay? So that's where we come in and we help individuals fill that gap of 20%, whether they get a supplement or a advantage plan.
Okay.
So that's how that works in respect to Medicare.
Well, let's say I'm 65 and that I'm still working and I have my employer's, insurance that I've had for 30 years or more. Am I penalized if I don't take Medicare, or do I stop what I have with my current employer and sign up with Medicare?
No, when you turned 65, as long as you're still with the employer, you do not switch out the plan to Medicare. The only time you switch out to Medicare is when you 65 and you leave that employer, and that's where it mandates that you have to get Medicare, Part A and B.
You won't be penalized.
I will be?
You won't.
No. Oh, I won't be penalized.
No.
Okay,
No.
That's good. So people that are still working, they're safe to keep what they have, and then when they retire, they can go in and. So is it a hard or arduous process To apply for Medicare, do you have to go to a particular office, or can you do it online? Or
Well, the thing about this, it's not hard to apply, but the most important thing is that do you understand all the details of the plan? Okay. Now you can find the details on the with the plans, but then do you understand what company is good for certain areas? Because one thing about healthcare is that carriers choose different areas to work with, and certain carriers will have a bigger network in one area versus another. And with Shirley and I, we're a broker, so we basically have all of the carriers that are playing, let's say in Virginia or Maryland or DC, and we know which carriers has a certain product that will be more advantage to the customers versus another. But as a customer that's trying to do it by themselves, they might not get all those details, and they might not understand those details that's very important to them. So that's where we provide that free service to help them understand these plans and the carriers that are providing those plans.
So you offer a cafeteria style system where when people come to you, you have more choices of carriers that they can. Okay, so since we're not talking about one carrier, can you name some of the carriers that you support?
Well, like for example, United Healthcare, Aetna, MedStar, Humana, those are some of the major players. But then you got to understand one thing is that the healthcare industry changes from year to year.
Yeah.
You might have United Healthcare in one area, but then next year they might not be there anymore. They might have their coverage somewhere else, or Aetna or Humana, it doesn't matter. The fact of the matter is that you have to be updated every single year, and the open enrollment will allow you to have the time to understand where these carriers are going and what plans are involved. Like Shirley just said, hey, there's a zero premium plan this year, where a lot of people don't know about.
Right.
And it's our job is to to be able to communicate that. That's why we do seminars at senior centers to educate them so that they're more aware of it, so that they can make an educated decision once they pick a plan.
Right. Well, I definitely want to know more about the zero premium, because that's one I'm not. I've heard a little bit about it, and I know that some plans have a few zero premium plans, but it sounds like this one has opened up and that it's available to more people.
Yeah, and again, the zero cost premium plan depends on the area, on the county, and sometimes we can go down to zip code. So on the county that they have, it's not all insurance carrier is playing in that field, as well.
Okay.
But the one that do play in the field, they select their territory. Now, one question one may ask, well, why? Who's paying the zero cost premium?
Right, that was my question I was going to ask. Who's paying?
Right, who's paying the cost, and how can they do this? Okay, some of the carriers are able to do this is because they want to look in terms of the customer support. If they've got a huge network, if they own a lot of hospitals, if they own a lot of facilities, and they've got a huge network of doctors that are associated with them, so they could create what is called a very, very affordable cost in managing the healthcare cost. And of course, one rule is they got to go to the HMO plan, whereas they got to go to those designated doctors' facilities to keep that cost down. But in return, that saves a lot of money. And of course, that's why they can offer zero cost premium. Now, there's more behind it. And of course, they also get subsidy from good old Uncle Sam as well.
Right.
So with that case, federal government gives them certain grant money. It depends on the clients that they sign up. And that's also how to help manage the cost down.
Well, Shirley, what about, zero premium? Does that mean, is that just a teaser to get people to sign up, or does it stay that way? If I sign up and it's zero this year, does that mean that next year it might or might not be zero?
When you say zero premium, people have to still understand they still got to pay for Part B.
Right.
Okay, that's the basic, number one. Because a lot of time when you say zero premium, you say, I'm not going to pay anything.
Yeah.
No, you still have to pay for your Part B. Okay, but like Shirley said earlier, the government subsidized these companies to be able to take care of all these claims and everything else, which opens their resources to do other things, so that basic Medicare doesn't have to take care of that. And because of the subsidy, that allowed the insurance companies to provide that zero premium. Okay, and the plan details, there's of course there's going to be deductibles and other things in there in the plan, just like any other plans. But it is a zero premium plan.
Okay. Yeah. Let me make it very clear about the Advantage plan. Okay, so you got A for hospital, B for doctors. Okay,
Right.
A and B pays 80%, 20% gap. So you add in the C part, which is what we're talking about here. The C part, now they can pay different carriers today. However, if they choose certain company, they can now have zero cost premium for that C plan that pays the 20% that A and B don't cover. Okay?
Oh, okay.
And some of the zero cost premium plan will include prescription, other carrier do not. So again, it goes by the carrier. And the best way to do is for a person to really sit down with a person and say, okay, here's what I currently have today with this new plan that you have. Tell me what the benefits are. Tell me what the benefits are. Tell me what the copay is. Tell me what the doctor visit is. Is there a deductible, and co-insurance? All those questions plays into a very important factor when someone determines whether or not, what's good for them,
So when you and Bobby go into a home or you're at a seminar or someone is coming to your office, do you do a needs analysis to try to help them figure out what they need, or do they come in knowing exactly what they want and what they
we
need?
usually sit down, number one, make sure they have Part A and B. And then we want to have a list of all the, the prescriptions that they have to kind of understand if they're healthy or they're not. Do they go to a doctor or not? A lot. And based on that, we can sit down and show them 3 different companies with those type of plans. And then we can evaluate to see which plan will fit the needs of the client. Because just because one plan has all these benefits doesn't mean it benefits that particular client. So it's a basis case per basis.
Right.
Yeah.
So I think what I hear you saying is that it is important to sit down with people, because one person, the basic Medicare, the supplement, may work better for them given their illnesses if they have them.
Yes. Yeah.
And then there are other people that the Medicare Advantage will work for them. And I kind of had a situation like that with my mom.
Yeah.
She had retired many, many years ago, and she was just on the basic, but she was paying almost $400 a month for that. And she doesn't have any health problems. So 2 years ago, we switched her to Medicare Advantage, and she's doing fine and paying a lot less.
Yeah.
Yeah, we had a client, it was interesting. We saved him a lot of money. Not only that, with the new plan he's going into now includes dental. He didn't have dental before. He's paying half of the price, and now include
more.
dental, and have many more benefit than what he did.
And he's on an Advantage plan?
His copay got less, and everything else got less. His doctor got less. He goes, wow. He said, I get all this? He says, no brainer,
Wow.
But you know what? But still, there's so much education, and I'm afraid that we don't have enough time
Right.
for the people to sign up and do all these things right now.
Right. Well, what we're going to do when we come back, we're going to take a station break shortly, but when we come back, we are going to get in a little bit more about the zero premium, and I want to ask you some questions about MedStar, because I have heard about them. I mean, they're new to me. I've heard about the others that you mentioned, but MedStar is a new one to me. And so we will going to take a short station break, and we will be returning real soon. So don't touch that dial.
They say it takes a village. We focus on the truth about things that are happening in the DMV through the voices of the people who live, work, and play on Main Street. Tune in every week to discover how the community is coming together for the greater good of every resident.
Welcome back. You're watching Skills to Pay the Bills, and we are discussing health care under the Affordable Health Care Act. We haven't gotten to that yet, but we will. And we're also talking about Medicare and Medicare Advantage products during open season 2015. I am going to get a couple of affordable health care questions in before we leave, but I want to get back to this MedStar. Now, my understanding, which could be totally incorrect, is that the MedStar is basically a Maryland plan put together by physicians and other medical professions. Is that correct? Tell me about MedStar.
Okay, again, MedStar wanted to have very, very affordable health care for clients. And because MedStar really before owns a lot of hospital.
Oh, okay.
Yeah, so because of them owning a lot of hospital and they affiliate with a lot of different facilities, So that's how it was born. So this thing came out and said, okay, well, why not? Why not get into Medicare? Because we have the facilities, we have the doctors, we got all the network we have. Let's bring the clients to us that we can manage it under one roof and give it really, really quality care at it. So they decided to came out with the zero cost premium plan. Again, it is not available everywhere. They are available in Maryland and DC, okay, with the exception in Maryland of Calvert County and Montgomery County.
But not in Virginia?
Not in Virginia, but don't be so discouraged. There are a lot of other carriers that came out, and I looked at their plan. In Virginia, also zero cost premium, that's very attractive as well.
Okay.
You know, so.
But it's not MedStar. It's
not MedStar.
Okay.
It's another carrier. Almost all different states got all the different carriers.
Well, that goes back to Bobby's point earlier about why it's good not to put your eggs all in one basket. I mean, you have a multiplicity of carriers that you can help people with. So if one doesn't work, there's something else right behind it to do that. Now, do I have to make a certain income in order to take advantage of zero premium?
Absolutely not. That's a nice thing.
As long as you have Part A and B.
Yep.
And that's all you have to have?
Yeah.
Part A and B.
So, okay, so how does this process work? I'm 65 years old. I give you a call, or I give MedStar a call. And when you come out to visit with me, what can I expect? What kind of documentation do I need to have? Do I need to have any documentation? What can I expect when you come to visit me?
In order, before I can come out and see you, I gotta have what's called SOA. Stand for Scope of Appointment. We can't talk to you technically until you gave us permission to come out there to talk to you.
So is that your rule or government rule?
Government.
Government rule.
CMS.
CMS. Okay.
CMS.
So, Centers for Medicare and what, Medicaid? Centers for Medicare and Medicaid?
Yeah.
I think that's what it is. Yeah.
So therefore, you sign it, you approve it. I have the scope of assignment already, and then I can come out 48 hours later to sit with you to be able to go over the plan of what it is. Now, the SOA, it is not a promise that they will sign a plan. It's just giving an authorization. Because a lot of seniors like, I don't want to sign it. I don't know, I have to look at the plan and all that, you know. So, you know, they're always afraid of signing something, but we can't discuss the plan or talk to them about that stuff without them giving us permission.
Okay.
So that's mandatory. Now, once we do that, then normally what we do is I sit down, I have a sheet of paper that I kind of go through. Okay, let me first of all find out what exactly do you have. You know, Bobby mentioned earlier, you have A and B. Do you have certain doctors that you just really don't want to change? Do you have certain prescription that you take? All those. And then I looked at, okay, do you have supplement today? You know, for the, do you have Advantage plan? What do you have? Or do you have prescription plan that you're paying on top of the other stuff? Or you don't have, or do you have Plan F? So all these things, and by the way, are you getting Medicaid? Are you getting Medicare and Medicaid? Now that brings into another different plan as well.
Right.
So with that understanding, after I look at it, and then we said, okay, so let's really do a plan comparison. You know, today you're paying this much amount, and you're doing this. And I do pretty in-depth analysis with my clients. You know.
So when you're going through that, one of the things that I've heard people talk about that they don't understand real well is under the prescription portion, all of the tiers. Don't they have several tiers, and each tier means something? So is it important to know what kind of medicine that people are taking? Or
Yeah, we usually try to find that out on the, you know, on conversation, you know, what kind of medicine they're taking. And of course, like I say, most important thing, they have to have Part A and B first. And, you know, based on that, we take a look at the formulary in the different plans and then to see if it fits what they're taking also.
Okay,
that's
good.
very important.
We do have a cheat sheet.
You do, and you have those to help out, right?
A cheat book.
Right.
Yeah.
Well, to me, it sounds like while the world of Medicare and Medicare Advantage products is friendly, it's complicated. So what do you say to people who are trying to navigate this all by themselves? Is that the way to go?
You know what, I don't want to say it, but if they try to do it themselves, they might not get all the details that's very important for them to know.
All right. So they need to get with the
Yes,
professionals.
with somebody that knows.
Right.
Even with us, we're overwhelmed. You know, I mean, my brain's, you know, and I'm sure Bobby's brain is just the same, you know.
Right. And the government's always changing.
Well, you
They're
know,
always
it's only
changing the
that-
rules.
Well, one of the things is that, one, we have to be certified almost with every single carrier. Besides certified as a whole, they call it AHIP training, and then we're going to certify each carrier as well.
It's a long process.
Okay.
You know, that's why they want to make sure we know what we're doing before we
Right.
go out there to talk to clients.
So you just can't call up and say, hey, I want to sell Medicare products. And they say, oh, okay, sign on the dotted line, you know, pay $10. It's
very highly
you go
regulated.
through, it's highly regulated, and you go
Yes.
through intensive training on that.
Exactly.
Okay,
Yes.
good. Well, as you said, Shirley, I mean, we're going to be having other segments about Medicare, and we go up advanced and get to some of the advanced stuff. But I do want to get to a little bit about the affordable health care. What is the update? Can you give us a quick update? Are things better than they were last year? Are they in the middle, or is it just falling apart?
Well, it all depends on what state you're in.
Okay.
State meaning the states of the United States.
Okay.
But thing about it is that this year with Obamacare, the open enrollment is the 15th of November, only to the 15th of February.
Oh.
Okay, last year was
Isn't
the,
that shorter?
Yes,
Yeah.
it's shorter. Now, as far as the system, it's still the same.
Oh, wow.
So I hope that it gets better by the time open enrollment is. But there are changes this year. You know, certain networks, certain carriers are changing where they have their services.
Okay.
So I encourage that anybody that has enrolled already needs to re-enroll, due to the fact
Wow.
that, you know what, you have to update your application, and you got to pick a new plan because all the plans are changing. I mean, the max out of pocket from $6,350 is going up to $6,700. But for a family, from $12,700 to $13,200. So the details will change, the carriers will change, and plans will change.
Okay.
So
Wow.
if you don't have it, you need to get it. If you have it already, you need to reapply.
I'm just curious, Bobby, last year, how many people did you enroll into the program?
Over 1,000 people.
Wow. Shirley, what about you?
We did a little less, 500.
About 500. Wow.
Yeah, so you know, this year we're doing it even bigger because, like I say, we're educating people on radio, on TV. We do seminars on a weekly basis because people need to learn about all these details because a lot of people did it wrong last year and they're paying for it.
Well, this is another question. The noise out there about the Obamacare, it goes from one spectrum to the other end. You get some people who love it, they think it's great, it helped them. You get other people, the jury is still out, you know, they're not quite sure. And then you get another group that hate it. So it's hard for people to determine fact from fallacy. What do you suggest a person do in order to learn and find out about it for themselves and maybe not get into the media hype or the hype that's going on?
I mean, first I have to say the people that love Obamacare are the ones that get the tax subsidies.
Okay.
The people that have to pay full price for the insurance definitely hate it because they're paying for something that's very expensive. But on the Affordable Care Act, they're covering for people that are sick. They're covering for a lot of other services they didn't cover before, and that justifies how much they're charging. Okay. But you know, and a lot of people that do have it that don't like it is because they picked the wrong plan. And one strict rule with the Obamacare is that once you pick a plan, you can't change to the open enrollment of next year.
You have to keep it.
Yes, so a lot of people see the price and they pick based on the price, not whether it's a PPO or HMO or you know it's a good company or a bigger network, and they don't know that at the first time. But this year, I know a lot of people are going to look for people like us that's been doing it. That we know what's the best plan for them. We know how to pick and choose what carriers.
Right.
Yes.
Well, what about the? Oh, I'm sorry.
That's one thing different about the Medicare. For example, MedStar. Even if a client enrolled into a plan, which effective January of next year, but if for some reason between January through February 14th, and they're saying, I don't like this thing, they can go back to the old plan.
Okay.
Yeah.
Now, you just said something that made me think, do we need to make sure that our viewers know that Medicare and Medicare Advantage products is one thing. Obamacare is something totally different, because there are some people, I've talked to some seniors, and they think that somehow the Medicare Advantage products somehow filters into Obamacare.
Well, the major difference is this: 65. I mean, if anybody that's under 65 can qualify for Obamacare, but you 65 and over, you're with Medicare.
Okay.
So that differentiates.
So they're
the
two
two
different, right?
That's
They're just totally two different things
healthcare,
on
but
that.
it's the age that changes. You know.
And then you have Medicaid, which
Yeah.
is a totally different breed of animals as well on that.
We're just about out of time, but I want to put in the shop. The shop is for the business owners. Did that work a little bit better than the other, or is the jury still out on that
You have
as
to-
well?
Yeah.
I volunteer Bobby or shop.
One thing about the shop, I have to say, is because it's not online yet. Everything you do is you have to fill out paper app. You gotta send it in. You gotta wait for them to review it, call you, and kind of go all over details. It's a long process.
Wow.
And because of that, it's not working the way it should. Because if it fully opens, then people can actually do everything online, but it's not to that extent yet.
Right.
And I'll tell you what, ever since Obama came out, it's more the individual market versus the group market.
So it
The
sounds like
insurance industry has changed.
Well, one client today, just very simple, she said, oh my God, she goes, I talked to every different broker on the shop, and every one of them gave me the different answer on the plans. And yeah.
So it sounds like it's still out to,
No.
the jury is still out on that too. Well, we are out of time, folks, and I want to thank Shirley Liu and Bobby Lee for updating us on the Affordable Health Care Act and on open season 2015 for Medicare and Medicare products. Your health is very important, and the systems we talked about today have many components. Trust me, they have many components. Please don't try to figure this stuff out by yourself. Call in folks like Shirley and Bobby who can help to navigate you through the process. It will make the difference in whether you have 20 new gray hairs at the end of the year or only 2. Thanks for watching Skills to Pay the Bills, and we'll see you next week. Bye-bye.